Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is uh, with you, and I hope you all are fine. And here, where I am in Hyderabad, Pakistan, the cold weather is going on. So I think the same situation is in the other countries also. Uh, Let us start with the community medicine topic, which is just surveillance of the disease or disease surveillance or surveillance of the public health. So, surveillance is a very common word, but it is not used mostly in the clinical setting. And even the management, monitoring, and evaluation is used more, but surveillance is a public health terminology. And I think the students of community medicine should have a grip on this concept. So the surveillance is basically a non-stop, a continuous monitoring of the disease situation or any threat or any risk which is biological in nature or anything which is chemical or which is also environmental. And in some time it is also applied to the use of the resources and uptake of the hospital services or health services. So, surveillance is a multi-dimensional concept, and I think you will, at the end of this lecture, you will understand better. So, later I should start with my presentation if I can share it uh, easily uh, to my. So, this is okay, fine. So I am sharing and I think it will be visible to you. So instead, this is my YouTube channel and WhatsApp channel links, and at the end you can see and please like it, share it, and let us start from the first slide, which is very important. You can see that this is a concept of the surveillance of disease or public health surveillance. You can see on the top picture that the whole world is being watched from a magnifying glass so that you can understand the entire situation. And at a micro level, if it is a disease spreading in the world, then you are just moving behind that disease and you want to cross and stop it at somewhere. And the another concept is surveillance, which you can see here that surveillance is a multi-dimensional health services uptake, vector distribution, environmental hazards, injury, chronic diseases, infectious or communicable diseases, and even emerging and non-emerging, and you can apply on the. So let us quickly see disease surveillance is continuous. This word is important. Systematic, this is important. Gathering, analysis, and interpretation of health data to monitor health trends, detect outbreaks early. And if you are not detecting the outbreak early, the same is going on for the polio in Pakistan. The surveillance system is quite slow, and the polio spread or polio infection or polio virus is, I think, hiding in certain places, and our vaccination and campaign is not only two countries, Pakistan and Afghanistan, failed. So this is basically a failure of the surveillance system, not vaccination or program, and guide public health action like policy, prevention, and resource allocation. So this is another definition: systematic collection, analysis, interpretation of outcome specific data of use in the planning, implementation, and evaluation of public health practice. Public health practice is the applied side of the public. It includes data collection, analysis, dissemination means you have to disseminate or give information to the users, to the stakeholders. Uh, then this is another simple definition. Same thing is must occur on ongoing basis. The sufficient accuracy and completeness. and utilization of information for disease prevention and control. Then coming to the it is the early warning system, and this can be the part of your MCQ if you are in MBBS. That surveillance system is equally as a early warning system in the healthcare or in the diseases. So this can be one of the option. Be careful about this. At the end, I will show you the MCQ also. It uses methods like passive reporting, active searching, integrating sources from hospital labs, records, and even animal health to understand disease patterns and respond effectively. In diseases, most of the diseases and viruses are actually zoonotic origin. And this is a simple that how the surveillance cycle, it will continuously conduct survey, prepare survey, and then analyzes the data, collect the data, release result, and data to action. So this is important and implement policies and programs, and if required, then you have to understand and do the information surveillance. So this is a public health surveillance and health data collection, reporting, evaluation. Another surveillance picture, you can see injuries, health services, and even environmental hazards. Then this is a chart which shows that at least surveillance is to enable research, evaluate and control measures, to track channels in risk factors, to measure changes in incidents, and to detect and characterize new diseases. So coming to the another, you can see that how the population at risk is also covered. So trends, disease management, patient outcome, and then even surveillance moves to the then coming to the